So, Joe, thank you for doing the interview.
Thank you. You're welcome. And
Uh,
I'm really honored that you've asked me to share a little bit about myself and my work and my vocation. And I'm very honored. Thank you.
yeah, I'm super excited. So these interviews are about heroes in our community, so heroes around us. And at the Matrix Guard, we believe everybody is a hero. The
Yeah.
only question is whether they know it yet.
Right.
Whether they've identified their hero. And we strive to make unstoppable heroes. And what makes an unstoppable hero is someone who consistently tries to do good for the world. They don't always have to be good. They don't always have to be on. They'll fall like any hero. They'll struggle. They'll need to ask for help, but they're resilient. They get back up and they continue to help others. And you absolutely fit the bill. From getting to know you, I completely adore you. So thank you so much for taking the time. I know
Thank you.
you outside of what you do.
Yeah.
And it's going to be really interesting for me to find out more about what it is exactly you do. So why don't you kind of tell us what you do?
Well, I am a licensed clinical social worker. I am licensed here by the Board of Behavioral Sciences in California as a licensed clinical social worker and psychotherapist. So I am a social worker with a specialty in mental health.
Mm-hmm.
And by uh, education, I am a gerontologist. So I've worked primarily with elderly.
Okay.
My focus has been primarily in mental health, and I work with the severe and persistently mentally ill community. And I've been working in that capacity for a decade.
Okay. Yeah.
Prior to that, I worked in nonprofit in the LGBT community, in the work of community activism and community work for people living with HIV and AIDS. And I'm
Oh, wow.
a gay Latino male, although I look very Caucasian, but I gravitated to that because of my identity with my communities. So I identify with both the LGBTQ community and the mental health community.
Very cool. It's a fascinating two different groups. It seems
Yeah.
to me from the outside that the struggles would be really different, and I don't want to call them pressure points, but the stress amplifiers would be
Yeah.
very different. Is that what you found working between the two groups?
Stress, yeah. I mean, definitely when you are having to deal with issues of identity, sexuality, and mental health, yeah, there's a lot of stress. And interesting that you label it as stress identifiers.
Amplifier is what I called it, and
Yeah,
it's not a term I've heard before. It's
because there is a prevailing theory in the mental health scientific community that stress has a strong correlation to some severe onsets of mental illness like schizophrenia and bipolar disorder, and even schizoaffective disorder and other mental health disorders. Stress has a relationship that we have been able to identify, though it hasn't been conclusively proven that it does. But in my experience in the mental health community as a professional for 10 years, I have definitely seen the effects of stress in the lives of a lot of my patients. And as a gay man, as a Latino gay man who doesn't look Latino because I look Caucasian, I definitely know the stress of both wanting to fit in my own Latino community, my own Hispanic community, and at the same time being seen as white, as Caucasian.
mm.
Though I am, in all respects and intents, I identify as a Hispanic male. Yeah.
And it's something I've heard a lot from uh, different minority friends, is that sometimes you feel like you almost straddle two communities, and by straddling, you're not really part of any one community.
Yeah.
And that's a whole other, can of worms, so to speak. Like that has to be, I don't know it personally, but I recognize that's difficult.
It is. My least, my one of my dirt, my what's the word I would call one of my I guess dirty words is stereotype.
Mm.
And I hate it because people. I think people need to feel comfortable when they look at someone and they can neatly categorize them to make themselves feel comfortable. And I have relatives who are Black. I have cousins and nieces that, if you were to look at them, they would be Black or African American. But the thing about being Caribbean is that because we are an Afro-Hispanic culture, we have the full range of races.
Yeah.
But we all typically identify fundamentally as Caribbean or
Yeah.
So when people look at someone and then they see their skin color, they immediately make assumptions about that person, which are highly unfair.
Yeah.
When somebody sees me, and when I first moved to California after I left the Air Force, I discovered that even though I was Hispanic and I spoke Spanish, that whenever I would try to engage in the Latino community, I was given a very, very clear perception of who I was. And it was almost like, why does this, gringo speak Spanish? Why does he know our language so well? And they would then kind of be very confused. And so that's one of the things that I really constantly have this real strong kind of affinity and sensitivity to.
Yeah.
And I think it's for a lot of people in the communities of color, they have this kind of built-in ability to sense these microaggressions and these little subtle ways of how we interact with each other.
So you mentioned that you were a psychotherapist, correct?
Yeah,
did I get
licensed,
the term right? And a social worker. So
yeah.
What is the difference between a social worker and a traditional therapist? What does a social worker traditionally do?
There are a group of mental health professionals that are licensed to be able to practice psychotherapy. Mm-hmm. Those being psychiatrists, of course, psychologists, licensed clinical social workers, licensed marriage and family therapists, or LMFTs. Those are, in my understanding, those are the primary professions that you can become a licensed psychotherapist. A licensed psychotherapist is governed by a board that oversees the profession, and you are held by a series of legal and ethical guidelines and mandates that you have to observe and follow, and you have to renew your license periodically every 2 years. You have to meet a certain standard of practice that qualifies you to engage in essentially the practice of getting into somebody's head.
Yeah.
Yeah.
Which, I mean, it's good that there's that many oversight, because you have the ability to really help somebody, and
yes,
you
of
have
course.
The ability to maybe do some damage.
Yes, and in fact, my board, I am under the Board of Behavioral Sciences of California. We can have complaints filed against us, and in some cases, we actually have to go before a panel, a tribunal, to be judged if we violate any of those rules or any of those mandates. So we are even required to get an attorney if we have to be represented in front of a board complaint. Yeah, like any doctor.
Yeah. Wow. As a social worker, what is your type of clientele? Because in my mind, I think of a social worker as in for some reason it's working a free clinic type
Well,
scenario.
the unfortunate image of the community about social work is we come and take your kids. We come and take your children. And the reality, and for your audience, I hope that they can research this a little bit more. But the profession of social work is one that has existed since almost the Civil War. It's existed for quite a long time, along with nursing. It has only become codified and more regulated because of the needs in the mental health community to free psychiatry to focus primarily on medication management.
Okay.
So social work was able to get into the field of psychotherapy because psychiatrists would not be able to provide individual psychotherapy with their clients. And so they would have to refer strictly to a professional who would provide the psychotherapy component of the treatment. So, and that's the same thing with licensed marriage and family therapists. Psychologists have always practiced psychotherapy, with the exception that psychologists do not prescribe medications, and neither do LMFTs and LCSWs like myself.
Yeah.
So my specialty as a licensed clinical social worker is the field of mental health. And my specific work that I do day to day is with the severe and persistently mentally ill, which means that I work with the most severe cases of mental illness that you see in the community. And I typically work with people who are indigent, homeless, disenfranchised, and generally underrepresented in the health field. Meaning, I work with people who don't typically have health insurance.
Yeah. My sister, who we had earlier in an interview last month, is really fascinated in the mental wellness of homeless people in that group. She works in the prison system. So there's a similar high stress type situation that aggravates a lot of these types of things. One of the big things, obviously, with homeless people, there's this stereotype that they're dangerous, they're super sick, we need to stay away from them. And one of her big points was they're actually much more at risk personally or of hurting themselves than of hurting anybody else. So I think removing some of the stigma around that is a really good, powerful thing to do.
I've been working in the field of mental health, in the field of community health for close to 20 years, of which 10 years I have now worked in that field, especially in mental health and as a licensed clinical social worker. And I have even worked the first 5 years of my profession as a licensed clinical social worker in the field of psychiatric emergency services, or the what is commonly referred to as the PET team, the psychiatric evaluation team. These are mobile teams that go out in the community. We get called by families with a loved one or a family member who's struggling with mental illness, who might be psychotic, might not be eating, might be suicidal. And I would go to their homes and I would do an evaluation, and I would then write what is called a 5150 to hospitalize them.
Mm-hmm.
In the entire time that I've worked in this field to this day, I have never been hurt, nor have I felt fearful for my life in working with my community.
Well, and you're working with some of the, what would be
and
considered...
I work with the most severe psychotic. Absolutely.
God, that's completely different than the story that we get shown all the time.
And so, every time I hear the stories about guns and shootings, none of the clients that I work with, first of all, if they've ever been placed on a 5150, can they even own a gun?
Yeah.
But two, most of them are in such a psychotic state, in an internal world of their own hallucination, that they would even fathom the idea of hurting even an individual or a mass group of people. These are people who need help. They need support, they need connection, and they need treatment. They don't need to be put in jail. They don't need to be vilified. and it's really disheartening every time I see that in the news, and I see it more and more now. It is a scapegoat, and it is truly unfair.
Working on the stigma of it, what exactly is schizophrenia? Because in my mind, I see the stereotype of hearing voices, talking to themselves, really erratic behavior. What is actually...
Well, without giving you the kind of the Wikipedia, WebMD definition, essentially, schizophrenia is a chronic mental illness. It typically, statistically manifests primarily in males, typically with an onset of anywhere between 19 and 26 years old. Whereas bipolar disorder is more typically shown in females. It's very interesting.
Interesting.
But with schizophrenia particularly, one of the hallmarks of that disease is that it typically has an onset, like the ages that I just mentioned. And we find that typically there is a genetic carrier of the disease, and it typically will manifest during a particularly stressful event, meaning that we might be carrying the genetic marker of schizophrenia, but it may never manifest unless we experience a significantly traumatic or even stressful event. And even then, we might not even manifest it. Or for some individuals, there is no stressful event. They just manifest schizophrenia. One of the things that differentiates schizophrenia from other mental illnesses is that it is primarily made up of two types of symptoms. There are positive symptoms, which are symptoms that add to the altered state of the individual, and then there are negative symptoms, which are things that typically are taken away from you. Generally, those would be blunted or flat affect, meaning no facial expression, which makes it very difficult for you to relate to others socially, because if you have no expression, other people, we are genetically and evolutionarily designed to react to facial expression, and when we're dealing with somebody who doesn't have that, we get that unsettled feeling. So
which is where a lot of the fear
another
comes
negative
from.
symptoms would be impoverished speech, just really difficulty with processing words and thoughts because there's a disconnect. The positive symptoms are the ones that we typically really well know: hallucinations, delusions, paranoia. Auditory hallucinations are the ones that most people typically associate with schizophrenia, meaning voices. They hear voices. When you see people on the streets who might be suffering from schizophrenia, they're having conversations or they're very agitated when they're talking to somebody who's not there. And that's because they're responding to either the visual or the auditory hallucinations.
It seems like it can create erratic behavior, but erratic behavior doesn't necessarily translate to violent behavior.
Correct.
And that's why it gets such a bad rap, is because people see somebody acting erratically, and as a defense mechanism for our brain is to find the thing that doesn't fit what we know. You know, new things are scary. Putting yourself out of your comfort zone is scary, just traditionally. And then when you see somebody who kind of creates that new sensation, there's an immediate like, oh geez. But that's not the case all the time, or most of the time, or some of the time.
So yeah, most of the time, David, they are actually reacting to either delusions or hallucinations. It is merely the way that they cope. It is merely the way that they're trying to protect themselves. If you were constantly being pursued by a demonic being, or you constantly heard words that were troubling and upsetting to you, or alternately, if they were holy messages, you would be in that reality, and it would be very difficult for you to interact with you or with me.
Yeah.
I think when you experience seeing someone who is in that altered state, I think the best thing that we can do is, if they are in a place where they might be hurting themselves or others, is to get them help.
Yeah.
You could call 911. your first reaction should not be to hurt them, because they have absolutely probably very little awareness of who you are, other than if you are being part of their delusion.
No.
Again, like I've told you, David, I have never been hurt, and I have never been in a situation where I felt that I was threatened, or I was, going to be attacked in any way.
How would you recommend, so someone who's not trained, someone who's not a professional, we encounter somebody who is acting erratically. How would you recommend we go about that situation? And it may not be like they're so erratic that they're presenting a danger, or a situation that would normally be found uncomfortable for somebody who didn't know what was going on.
Well, just go with your gut instinct as a human being. If you want to buy them a cup of coffee, if you want to buy them something to eat, do so. I think in my experience, David, the best medicine that you can give somebody who's struggling with severe mental illness is to give them a smile, to say hello to them, to treat them like human beings. And I'm not telling you to treat them. I'm not telling you, because you're not professionals, what to do. I am telling you to just have compassion. Unless they are in danger of hurting themselves or others, you can try to engage with them on a basic human level. You do not have to engage with their delusion or with their hallucination. And that's only if you feel comfortable. I don't want to suggest to anyone that they should do something that they feel uncomfortable doing. If you feel uncomfortable dealing with somebody who is in the throes of the most serious parts of their illness, you do not have to do anything. But what you definitely should not do is should not make fun of them. You should not ridicule them. You should not hurt them in any way, physically or emotionally, because they're not deserving of that.
Just showing people compassion. I mean, compassion is such it's an easy thing to do that we sometimes make harder than it needs to be. Yeah. Moving on, how did you get into this work? What drove you to it?
Oh, well, I served in the Air Force. I'm a veteran. And after I left the military, I did my tour of duty overseas. And then I had the GI Bill, so I knew that I wanted to go to school. So I got out, worked some odd jobs, and then I settled into volunteering. And I started volunteering in the LGBT community. I started volunteering in HIV and AIDS, because a lot of the members of my community were dealing with that. So I wanted to volunteer. I wanted to work in that field. And I started volunteering for AIDS Project Los Angeles. And like literally within months, I was offered a job. I was offered a job as a case manager, working with people living with HIV and AIDS who, because of the new antiretroviral drugs, were now living full lives. They were not dying. So I got hired for a special project that was funded by the Social Security Administration to help people living with HIV and AIDS to reintegrate into work and get their lives back. I worked in the nonprofit field for almost a decade. And then at that time, my boyfriend, now husband, said, you've been really working in this field. You seem like you really love it. You should consider, getting your master's degree. And then I applied for a couple of master's programs and got into social work. Yeah.
It sounds like you came to it because you recognized in your own community people were hurting, people with HIV and the LGBTQ community, the stress with that, and you were wanting to do good with something you recognized, and then you found that, I mean, helping people was something that you were good at, and that.
Well, yeah, David. So let me maybe share this with you. Yes. So first of all, no human being, child or elderly person, is untouched by issues of mental illness. The most common being depression. Um, that being said, my own first personal experience with mental illness was, I think one of the questions that you had shared with me in preparation for this
Mhm.
chat was, who was my hero? And actually, my hero was my aunt. My aunt was this powerful, strong woman who was in every respect someone that I looked up to, even as a child. She took me everywhere with her, and she was fearless. Um, and around 27, 28, she developed a pretty severe form of bipolar disorder.
Oh, I'm sorry.
And that was my first experience with a close personal loved one who was struggling with mental illness. And her own struggle with that illness was substantially dramatic for me, because she went from being that fearless, indomitable heroine in my life to somebody who had deteriorated significantly. Her episodes of mania were so severe and so violent that I was highly affected by it. Um, so I speak with personal experience from having someone that I love really struggle with it. So that's something I just wanted to share with you.
It's unfortunate, and that must have been really hard for the whole family. But especially as a kid without knowing really what was going on.
Yeah, yeah.
And
I
I'm
think
trying
it
to
was.
think back when I
Yeah,
was
I
little.
think when she developed the onset of her condition, I think I was probably 14.
Oh man.
Yeah,
Now, what made her your hero?
because she took this little shy boy, and we would go around the island of St. Croix. And this was a woman who, even as a Hispanic woman, she was relentless and fearless. And we would go to restaurants, we would go everywhere. And, she expected to be treated with respect and dignity. And she taught me to be proud of who I am. She
God,
taught
that's
me that no matter where I was and who I was, that I deserved the same respect and dignity that any other person should be entitled to. Um, she was also a very independent woman. She expected life to be lived on her terms, and I will never forget her, ever. Um, she is dear to me. I lost her some time ago, and I remember that it was the only time, other than to the funeral of my mom, that I traveled to the Caribbean to say goodbye to somebody I love.
yeah, for a kid at your age at that time to have uh, that style of role model and those lessons being taught, it's incredible. Like that gives such a good building block, a foundation, and creates such a wonderful person.
And I dare say that every single one of us, every single one of you, has that person. You have that individual in your life who is your hero. And I have a particular fascination with superheroes, as you know.
Yeah, yeah.
And of course, we share our love of the gaming community. So I think that the reason that human beings need to escape to a fantastical reality where heroes exist is because we need them. We need them in order to survive, and particularly to survive trauma and adversity. We need to create these supremely powerful beings that are incapable of of hurt.
That's such a good way of thinking about it. Like there's always, we all have those unique pressure points, those unique
Yeah, we
things
do.
that trigger or hit, or that we struggle with. And
Yeah, even like Superman, who is my favorite superhero, as you can see.
yep.
I have a framed comic book behind me. Superman is my favorite superhero, and one of the things that I love about the representation of Superman, everything else aside, is this is a superhero who is not even from our world, so he's an immigrant, and he is cast off by his own family to find a new life, and is adopted by a new family who teaches him what it is to be human. And one of the things that I love about Superman is that he is a completely indestructible God who is made completely vulnerable by his humanity. And I think that it's his humanity that is his strength. It's not his godlike powers, it's actually his humanity.
Yeah, I'm thinking about all the episodes and conversations they have where they talk about how when other people come from Krypton, and talk about how weak humans are, and all of those stories.
Yeah, and then if you go back to Krypton, everybody in Krypton are people like you and me. Yep. They don't have superpowers. It's only when they're introduced to our sun and to our atmosphere that Kryptonians develop these powers.
God, that's another great part of Superman that I never really thought about is he doesn't become a hero, what we define as a superhero, until he's put into a very specific situation.
Correct. Yeah. He doesn't become Superman until that crucible moment where he is having to confront both his actual self and his created self. It's one of the best stories in our postmodern.
I'm quickly swinging on it because I've always been kind of Superman's all right, but I don't like the idea of an all powerful guy. But the more I'm thinking around this. The setup, it's a very cool, it's obviously a caricature, but it's actually much more in line with what I think a hero is. And because it's literally a person into they're stepping up, not necessarily because they're a hero, but because they're somebody who can in that situation.
And if you like Joseph Campbell, I mean, the cycle of the hero. Superman is very emblematic of that journey, of the journey of the hero.
What makes a hero now? I mean, what's somebody that you would consider a hero?
I know. I think now more than ever, we need heroes, male and female, and non-gender conforming. We need heroes because they are an intrinsic part of what makes us find meaning in meaninglessness, in senselessness, in horror.
What's the trait of a hero?
What's the trait of a hero? I think heroes are powerful. They don't need to be physically powerful, but they need to have a trait that distinguishes them from everybody else. But what makes them uniquely heroic is that they do not use that ability, that power, for their own self-good or aggrandizement. It is something that is given to help others.
Interesting. So to put it kind of another way, it's somebody who uses their unique talent to help people, to improve the community's life.
To advance their community, to find meaning, to empower. And I think that in our current climate, there is this perception that you have to be um, beautiful, that you have to be strong, that you have to be influential or powerful. And I think what the tragedy of that is that it is not, that is not what I consider to be heroic. Um, it's everyday people buying a cup of coffee to a homeless person on the sidewalk, stopping whenever somebody needs help, and giving up their time and their compassion. And that is what is heroic. And
Yeah.
it doesn't get shown on the news. It doesn't get popularized.
So, with the social work, what's an MVP moment you've had, either when you were working with the LGBTQ community or with your current work, that
Yeah.
really made you, proud of what you were doing, or where you really got to affect somebody in a positive way? And I don't mean like you were able to heal somebody or cure, just something that, what was your MVP moment?
Well, I have many. I'm very happy to say, I'm very proud to say I have many. Um, I don't think I can do this work if I couldn't find those moments, and they're very, very few, where I felt that I was collaborating with someone on something powerfully positive. And I say collaborative because I don't believe necessarily that I don't cure people. I don't um, get rid of anything that is particularly damaging to them or that has been traumatic to them. My work is not to erase that. My work is to collaborate with my patient to find meaning and to find hope. And that's what I do. So my MVP moment, I think there are a few, but the one that I think most vividly of is, I have a patient of mine who is just, even with her psychosis and her struggles, and her, being homeless in the streets in Skid Row, with a struggle of a heroin addiction, that she is just about now beginning to embark in launching her own professional career as a mental health professional. Those are the people who can work with someone with severe mental illness, and these are the people who get it, versus somebody who comes from a private, uh, expensive university,
Yeah.
and never struggled with a personal connection to mental illness. They don't get it, unfortunately. I have some colleagues who don't have that experience, so they cannot really connect. And I say that lived experience and personal connection is what makes a difference.
Yeah, I mean, it's one of the things we talk a lot about and we try to hammer home is the difference between uh, empathy and sympathy.
Yeah.
And it seems to me, uh, people who've been through it, or
Mm-hmm.
people who haven't been through it, are very sympathetic.
Mm-hmm.
It's, oh, that's hard. That must
Yeah.
be tough. But
Yeah.
and people that have been through it are more empathetic, which is, you know, I'm here with you.
And oftentimes we don't even say anything because we don't have to.
Yeah.
And be sitting with that person and be fully connected to them. And that's why I do the work that I do.
Yeah.
And I want to make something very clear. That story is very rare. It doesn't happen often for the majority of the clients that I work with. Just being stable enough on their psychosis is, um, you know, um, watching television. That's about as good as it gets.
What's one tip or trick that you use to deal with the daily PTSD? Because that's something that, I mean, everyone, if they had that kind of in their back pocket, is.
So I practice I have a daily practice of meditation. I practice meditation and mindfulness. And I basically practice my own therapy on myself.
Gotcha.
Yeah. I am also very mindful of taking care of my body physically, because we accumulate cortisol and stress in our bodies. We have to find healthy ways of releasing it. And so for me, a lot of it is exercise and walking. I walk a lot. I jokingly kind of share with my coworkers, I'm going on my Jane Austen, because a lot of Jane Austen characters, they walk.
Yep.
Walk a lot. They walk miles. and I think probably Jane Austen struggled with something, and she found that walking was something that helped her to order.
Yeah, helped her process.
Thoughts. It was something that was able to help her to order the chaos of whatever it is that she struggled with. And every day I have my breaks and I go for long walks. Yeah.
God, it's interesting that you mentioned that. One of the things, so the past year and a half, I have been dealing with my own bits of depression that are grieving and the et cetera. And I am not good at taking care of myself in these situations. I'm just not. For a lot of reasons. But walking seems to be something that kind of gives me a little bit of spirit back. Like that's something that kind of lifts me up. And it's a lot of times it's like a 15, 20-minute walk. It's nothing big. It's not like I'm getting fatigued with it, but just the pacing, the change of scenery, being outside. Sometimes I take the dog, sometimes not. And I'm trying to do it more consistently because I know it helps. So it's interesting that that's also a way that you do it. And I'm sure a lot of people do.
Listen, David, we both are animal lovers. We both have dogs. Look at, and I'm one of those people that when I walk my dogs, I'm not on my phone. I am mindfully present with my dogs. Look at how they behave. Look at how they react when they go for a walk. It is something that is highly beneficial to them. It is in many ways their mental health treatment. Dogs are creatures that we have evolved into being companions for us, but fundamentally, we know that they come from wolves, and there is this instinctive need for them to be out and to walk, and just how beneficial that is to their mental health. You can only imagine how beneficial it is to ours.
And it makes sense. Like it's a way for them to kind of get out of the current world they're living in.
Yes.
Which is the same thing we're doing. It's when you're in a headspace, that's essentially your reality, your world. And the physical movement out of it can be very, very healing.
Yeah.
Well, thank you for sharing. That's
of course.
Appreciate
and
it.
Thank you for sharing, David. I think that those struggles and challenges are something that we all as human beings need to be very open about. This whole idea that we are incapable of stumbling or suffering is just really, really damaging.
The fear of being vulnerable or of admitting to it. And there's a huge stigma. So if someone has a twisted ankle, you can see the limp. If someone has a broken arm, you can see the damage. And there's something about mental struggles that, because you can't visually see them,
right? You don't see it.
You almost feel the need to hide it or ashamed of it. Because there's talking with psychologists, they mentioned something like, oh yeah, here's how you handle X, Y. And I was like, well, one of the things that was pointed out to us from our training in mental health first aid was don't say get over it. And she thought that was she thought it was very funny that we needed help with something that rudimentary. And I was like, well, but it's, come on. Like, think how many times in life you've seen somebody, throwing a temper tantrum or,
Yeah.
a kid doing something and you go, oh, come on, just get over it. And
Yeah.
like, it's not something you just get over it. That's not a thing. That's like any injury. Like,
Yeah, for some people, there is no getting over it.
yeah,
Because there is no over it.
yeah,
That is the reality. And, uh, if you or I had to struggle with schizophrenia, that's the last thing I would want to hear from someone.
So you are a DM, and
I'm
you
a
are an
dungeon master, sir. I
incredible
am
DM.
certified, vetted, and very experienced dungeon master. And I have been now pretty much for the entirety of my gaming life, my tabletop role-playing gaming life. I have been a dungeon master. Initially, because nobody else wanted to do it. And then eventually because when I sat in other people's games, I just always felt like I could do better. So, it's like it was kind of my experience. And so I've now just settled to the fact that I love being a storyteller. It is one of the fundamental ways in which I deal with my own mental health.
You are also phenomenal at painting the miniatures.
Oh, it's been one of my hobbies since I've been gaming. Yeah. I actually think of painting as sort of my own form of meditation.
Okay.
Whenever I'm in my little studio here at home, I'm usually my dogs will be nearby walking about, but I'm in my own world and I fully escape into, painting very miniaturized models and just the level of detail. And it's very grounding. It's, highly satisfying. I don't think about work. I don't think about my patients. I don't think about what's happening in the world. I'm just fully, focused in that kind of very textual experience of the paint, the brushes.
Because of the intricacy and the detail, it's almost something that you can't multitask.
Yeah.
Which I think is a really healing. It's why I gravitated to games, is because you can't multitask.
And even when I'm painting, I'm usually waiting for one thing to dry before, and usually I have kind of like an assembly line of things that I'm working on, and as one miniature dries, I'm working on the next one. And then of course, all the gaming tiles, the terrain tiles that I paint.
Joe, thank you so very much. This has been a blast, and getting to know you more is always fun.
Getting to you too, David.
Thank you.
Yeah.
You are doing incredible things in the community. The work of a social worker, I have a lot more, I don't want to say respect for, but admiration for.
Yeah.
It's a huge, you guys do a huge thing, and a very good thing.
It is in many ways like any other profession. You have your good social workers, you have your bad social workers. Like every profession, you have your paragons, and then you have those that don't quite live up to it. But we work with, I'm speaking for licensed clinical social workers. There's all forms of social workers, but some are not licensed. but as a licensed clinical social worker, I am part of a very honored professional tradition of working with the mental health community, and I work in, here Los Angeles is the largest, in case your viewers don't know this, but the largest mental health system in the entire country.
Wow.
Here in Los Angeles County, and I work for that county because we deal with a very high plurality of individuals with various forms of needs, and of course we now are struggling with a lot of people with homelessness, which is a whole nother
That's a whole
issue.
yeah.
It's political and socioeconomic. It's not just mental illness. When I'm not doing my professional work or attending conferences, or professional development, I am immersed in my escapism.
Yeah.
Which is Dungeons and Dragons, and has been since I was 18-year-old in the Air Force, first time away from home, and bonded with my friends who, I started to game with, and, pilots and, boom operators, and we would get together every Saturday and we would game, and sometimes we would game until Sunday the next day. And we would be drinking a lot.
Yeah.
And sharing stories. And ever since then, it's just been a part of who I am, a part of my identity. And I'm a very proud gamer and part of the gaming community. And I want to talk more about that, because I think that creative part of me is what balances this kind of very practical, rational, scientific part of me.
There's something really delightful about a D&D game, because you're with a group of people with a shared goal who are all interesting, and it takes the time component is a really nice thing, because you have to settle into it. You can't do a hit and run D&D game. Like it's something that you have
can't
to
just you can't just turn on the PlayStation and run through whatever.
It's not a 20-minute here we go,
and then you feel that sense of satisfaction and then you turn it off. It's not like that.
Not at all. And it's like you say, it's something meditative, because when you actually have to settle in, your mind kind of relaxes into it, and it's so much fun.
And I think that's one of the things that for people on Twitch who like watching, streaming D&D games, is that they realize that it is really, really, truly a collaborative experience. That it is that these people are coming together and creating stories. And that's the wonderful thing that I think that streaming and Twitch and streaming in general has done for something very niche like tabletop RPGs, Dungeons and Dragons, and now bringing it fully into the mainstream, which is showing you what a typical D&D game is, and that it is not a video game. That there is comedy, that there is tragedy, that there is joy and frustration, and that you're all in it together.
Well, and I would almost say, it is like a video game. The best part of most
there
games
are elements that are video game like.
Well, and it's the story in games is often the most powerful element. The difference with D&D is that you don't know how the story goes. Like
it's the improvisational aspect of D&D. A good dungeon master is relatively proficient in improvisation, and I hope to always perfect. I've been kind of like contemplating taking an improv class.
I think it'd be amazing.
Part of me is like, but I don't want to be like pegged as like an actor who wants to get into like movies. because I would want to be honest. Like, I'm taking this improv class because I want to be a better dungeon master. And wouldn't it be great if somebody like, even like somebody like a luminary like Matt Mercer could do like a workshop so that people could come and really learn the art of improvisation, which is really fundamentally what a good story is structured around.
I am going to encourage you to do it because a lot of people who are just public speakers, just people who are trying to be better at presentating, and
I think it would almost be sort of therapeutic as well, because I'm a very kind of nervous person when I have to go in front of others.
Yeah,
and yet I do it for fun. Again, it's my own therapy, you know?
Yeah. So thank you, sir.
Sure.
It's been a blast. And thank you for all of the information. I want to summarize real quick some of the tips that we got during this.
Sure.
One is when we encounter somebody who may be going through something that appears to us to be a scary mental health situation, or an erratic one. I don't want to say scary, because if it's scary, obviously we want to protect ourselves and be safe.
Right. Exactly. Yes.
But if somebody's going through something that seems erratic to us, but isn't scary, the best thing we can do is just to engage with them as a human.
If you feel comfortable.
If you feel comfortable, yes.
Absolutely. You can offer that person help. You can offer to call someone like 911. You can, again, if they appear, to not have eaten, you can offer them something to eat. More importantly, more than anything else, you can just smile at them, smile and greet them like any other person. They are people.
Yep.
They just happen to be struggling with a disease for which there is treatment. But that person might be struggling to connect to that treatment.
Yep.
And then fundamentally, just have that awareness when you see them that they could be your brother, they could be your mother, your sister. Yep. They could be somebody that you love.
Some tips that you do to handle your difficult day, to handle your what you refer to as PTSD. It's the meditating is a huge help. The going for walks.
Yes, and meditate, and I walk, and on the weekends when I'm not working is when I dedicate time. I go to the gym, and I do cardio, and I do a resistance training, and I do yoga. So I take care of myself physically in order for me to process that high level of cortisol and stress that I have to deal with every day. Yeah. I have to be a clean instrument. Every day I walk into my office in order to help my patients. If my hands are dirty, I could do damage.
That's a great way of putting it. Yeah.
Yep. And actually not mine. That's actually from Carl Jung. Carl Jung was one of the early psychoanalysts, and he very firmly believed that psychoanalysts, which was the term that we used before psychotherapists, had to have clean hands in order to help others, like a surgeon.
Yep. Yeah, exactly. Like
body, you have to have clean hands. You have to create a sterile environment. As psychotherapists, we have to have clean hands, clean instruments when we are working with someone with mental illness.
Yep. Well, thank you, sir, so very much.
Sure.
Super appreciate it. Thank you.
You're welcome.
Thank you.